Disc bulge in MRI. If your MRI is showing disc bulge either in the lumbar spine or thoracic spine or cervical spine, what does that mean? Disc bulge in itself means that the jelly-like material which is there between the two bones of the spines, which are known as vertebra, that jelly-like material when comes out of its natural position, it is known as disc bulge. Now this disc bulge in itself is not the problem always. It is a normal age-related phenomena that some amount of disc bulge is common also. After a certain age, say around the age of 35 or 40, your MRI will definitely show some amount of disc bulge, but that does not mean that you are having problem because of it. There are various steps of this disc bulge, basically the various stages. Now these stages include stages of protrusion, extrusion or sequestration. There are various names given to this disc bulge based on the level of the disc that is coming out. So if it is the initial stage, then only some amount of disc material gets protruded. It may or may not press the nerves. However, if the pressure is more, or if this disc material starts coming out in a big way, that is a bigger chunk of the disc material has come out, then it can press the surrounding nerves. So if your MRI is showing that there is a pressure on the nerves, then that correlates if you are having pain radiating down the leg, which is known as sciatica. So if you are having leg pain because of disc bulge and the disc bulge is significant, then you should see your doctor, who will see and examine what type of situation it is, how severe it is, and where the disc bulge is. Normally, almost 97% of the patients can be managed with just rest, medicines, physiotherapy and exercises. Rarely we might require to give some injections in the back if the pain is not settling down, and in less than 3% of the cases, any sort of surgery is required. So disc bulge in itself is not the problem, but various stages of disc bulge is there. So now, depending on what kind of disc bulge you are having and what is the stage, your doctor might suggest you treatment, whether from conservative point of view or from operative point of view, depending on your symptoms. Thank you.